The monitor flatlined at 9:03 p.m. Dr. Brennan stepped back from the table, hands still gloved in blood, and said the words, "Everyone dreads. Time of death, 2117. Then a second-year resident nobody trusted did something that should have been impossible. For more stories like this, subscribe." The words came fast and sharp, cutting through the afternoon noise of St. Catherine's emergency department. "You're the replacement?" Dr. and Victor Brennan stood in the doorway of Trauma Bay 3, arms crossed, white coat spotless despite the chaos bleeding through every other corner of the hospital. His eyes moved from the tablet in his hand to the woman adjusting her surgical mask near the supply cart. Kira Hayes pulled her hair back into a tight bun, fingers moving with the kind of precision that comes from doing the same motion 1,000 times in worse conditions. She didn't look up. "Dr. Hayes, I transferred from the residency program in Portland 8 weeks ago. I know who you are." Brennan's voice carried the weight of a man who'd run this department for 15 years and didn't appreciate surprises. He stepped closer, eyes narrowing at something on her left wrist as she reached for a pair of gloves. "What's that?" Kira glanced down. The edge of her tattoo showed just below her sleeve, a medical caduceus wrapped in what looked like dots and dashes. She pulled the glove on, covering it. "Something personal. We have a dress code here, Dr. Hayes. Visible tattoos aren't part of it." She met his eyes for the first time. Green. Calm. The kind of calm that unnerved people because it didn't match the usual nervousness of a second-year resident standing in front of the chief of trauma surgery. "I'll keep it covered." Brennan made a sound somewhere between a grunt and a dismissal. He tapped his tablet twice. "You're on appendectomies today. Dr. Okonkwo will supervise. The patient in Bay 7 has been prepped. Routine case. Think you can handle that without improvising?" The last word landed like a warning. Kira nodded once. "Yes, sir." "Good. Because I've read your file, Dr. Hayes. 2 programs in 3 years. That tells me you either can't follow protocol, or you think you're smarter than the people teaching you." He leaned in slightly. "Which one is it?" She didn't flinch. "I study hard. Studying isn't the same as experience." He turned toward the door, then paused. "And that tattoo? Keep it covered. This isn't some strip mall parlor show." He left. The noise of the ER rushed back in, monitors beeping, nurses calling out vitals, somewhere down the hall a child crying. Kira exhaled slowly, the kind of breath that releases tension most people don't even know they're holding. From the corner of the bay, a voice broke through. "Don't take it personally. Brennan's like that with everyone." Kira turned. A nurse in dark blue scrubs stood near the medication cart, restocking syringes with the efficiency of someone who'd done it 10,000 times. His name tag read, Marcus Chen, late 20s, lean build, hair cropped short in a way that looked almost military. "I'm not worried about it," Kira said. Marcus studied her for a moment, eyes catching on the covered tattoo, then on the way she moved. Economical, no wasted motion, hands that didn't fumble or second guess. "You prior service?" The question came casual, but it wasn't. Kira's hands paused for half a second, then continued prepping her tray. "Why do you ask?" "Just a hunch." Marcus smiled slightly. "I did 4 years Army. Medic. You move like someone who's worked in worse places than this." "I've worked in a lot of places." She didn't offer more. Marcus didn't push. But his eyes lingered on her wrists, on the way she checked her supplies. Twice, methodical, the same pattern every time. "Well, if you need anything, I'm usually in trauma 2 or 3. Fair warning, though. Dr. Okonkwo doesn't like people who go off script. I'll keep that in mind." Marcus nodded and left, but Kira felt the weight of his attention even after he disappeared down the corridor. Recognition was dangerous. She'd spent 8 weeks keeping her head down, blending in, doing exactly what was asked and nothing more. But some things you can't hide forever. Her pager buzzed. Bay 7. Appendectomy. Patient prepped. She washed her hands at the sink, the water running cold over her fingers. In the reflection of the steel faucet, distorted and small, she saw her own face. Focused. Calm. The face she'd learned to wear when everything around her was falling apart. Some habits don't fade. Some training doesn't wash off. She dried her hands and walked toward Bay 7, past the residents clustered near the nurses' station, past the attending physician reviewing scans, past the family waiting in chairs that had seen too many people wait too long. Nobody looked twice. Nobody ever did. Kira pushed through the double doors into the pre-op area, where a young man lay on a gurney, IV in his arm, eyes half closed from sedation. Dr. Rachel Okonkwo stood nearby, reviewing the chart with the anesthesiologist. She glanced up as Kira entered. "Dr. Hayes, you're late. 2 minutes." 2 minutes in surgery can mean the difference between life and death. Rachel's tone was clipped, efficient, the voice of someone who'd earned her place and didn't appreciate people who hadn't. "You ready?" "Yes." "Then let's go. And Hayes, don't try anything creative. This is a teaching hospital, not an audition." Kira nodded. They moved into the OR. The lights overhead were bright, sterile, casting everything in sharp white relief. The patient was positioned, draped, monitors beeping a steady rhythm. Kira took her place opposite Rachel, hands steady, mind already 3 steps ahead. Rachel made the first incision. Clean. Controlled. Textbook. But as the layers of tissue peeled back, Kira's eyes caught something the scans hadn't shown. The appendix wasn't just inflamed. It had already ruptured, and the infection was spreading. The smell hit first. Faint, but unmistakable. The kind of smell that doesn't belong in a routine appendectomy. Kira's eyes moved across the exposed tissue, tracking the discoloration spreading through the peritoneal cavity like spilled ink. Rachel was already closing the initial layer, focused on the appendix itself. "Dr. Okonkwo." Rachel didn't look up. "What?" "We have peritonitis. The appendix ruptured before we got in here." Rachel's hands paused. She leaned closer, examined the area Kira was indicating, then straightened. The scans didn't show perforation. Scans don't always catch it early. "Look at the tissue discoloration. Smell it." Rachel's jaw tightened. She glanced at the anesthesiologist, then back at Kira. "His vitals are stable. For now. Dr. Hayes, this is a standard appendectomy. We remove the appendix, close, and monitor post-op. We don't go looking for complications that aren't there." Kira's hands remained still, hovering over the sterile field. Her voice stayed calm. But there was something underneath it now. Something that didn't belong to a second-year resident. If we close now without cleaning the cavity, he'll be back in septic shock within 6 hours. Rachel's eyes hardened. "Are you questioning my judgment?" "I'm identifying a complication. Based on a smell? Based on visual confirmation of infected tissue and fluid accumulation that wasn't present on imaging. The rupture happened recently, probably within the last 2 hours. The room went quiet, except for the rhythmic beep of the heart monitor." Rachel stared at Kira across the table, weighing options, weighing authority, weighing the risk of being wrong against the risk of admitting a second-year resident might be right. Finally, she nodded to the surgical nurse. "Suction. Let's irrigate and see what we're dealing with." The nurse handed over the suction catheter. Rachel worked quickly, clearing the area Kira had indicated. The fluid that came out was cloudy, tinged yellow. Infected. Rachel's face remained expressionless, but her hands moved faster now. "You're right. We need to debride and irrigate thoroughly. I can handle it if you want to oversee." Rachel glanced up sharply. "You've done this before?" "Yes." "Where?" "This isn't first-year curriculum." Kira didn't answer immediately. Her hands were already moving, requesting instruments with small gestures. The surgical nurse read instinctively. Retractor. Smaller suction tip. Irrigation syringe. "I've had additional training." "What kind of training?" "The kind that prepares you for complications." Rachel watched as Kira's hands moved through the cavity with a precision that didn't match her official experience level. The movements were economic, confident, almost automatic. She cleared infected tissue, irrigated with saline, checked for additional perforations, all while maintaining perfect sterile technique. It took 18 minutes. When Kira stepped back, the cavity was clean, the tissue healthy pink instead of mottled gray. Rachel examined the work, nodded slowly. "That was efficient. Thank you. Where did you say you trained before Portland?" "I didn't." Rachel's eyes narrowed, but before she could push further, The anesthesiologist spoke up. Vitals remain stable. He's doing well. Good. Let's close. They finished the procedure in silence, layer by layer, until the final sutures were in place. Kira's stitches were small, precise, evenly spaced. Rachel noticed. Those sutures. What about them? That's not the interrupted technique we teach here. It's more secure for contaminated fields. It's also military style. The words hung in the air between them. Kira met Rachel's eyes, said nothing. Rachel pulled off her gloves, tossed them in the waste bin. We'll talk later, Dr. Hayes. She left the OR. Kira remained, finishing the dressing, checking the monitors one last time. The patient's heartbeat was strong, steady. He'd recover fully now. Without the irrigation, he would have been back in emergency surgery by midnight, maybe dead by morning. The surgical nurse, an older woman named Patricia, waited until they were alone. I've been doing this 32 years, honey. I've seen a lot of residents come through. You're not like the others. I just pay attention. No. Patricia's voice was quiet, certain. You've seen things. Bad things. The kind of things that teach you what death smells like before it arrives. Kira stripped off her gloves, washed her hands at the scrub sink. The water was warm now, almost too warm. I study hard, she said again. Patricia smiled sadly. Whatever you say, doctor. Kira left the OR and walked down the long corridor toward the resident lounge. Her pager had been quiet, which meant no immediate emergencies, which meant she had maybe 20 minutes before someone needed something. The lounge was half full. 3 residents sprawled on the couch, 2 more at the table eating vending machine food. The conversation stopped when she entered. Dr. James Park, a third-year resident with a reputation for arrogance, looked up from his sandwich. Heard you called a complication Okonkwo missed. The appendix was perforated. Scans were clean. Scans aren't always enough. James exchanged a glance with the resident next to him. A woman named Sophie Chen. Lucky guess, then. Not luck. Right. Because second years are so experienced at identifying occult perforations. His tone dripped sarcasm. What are you, some kind of prodigy? Kira poured herself coffee from the ancient machine in the corner. It tasted like burnt plastic and regret. I'm someone who doesn't want patients dying from preventable complications. We all want that, Hayes. But there's protocol, chain of command. You don't just override an attending because you have a hunch. I didn't override anyone. I identified a problem. Dr. Okonkwo made the call. Sophie leaned forward, curiosity replacing skepticism. Where'd you learn to suture like that? James saw the photos Patricia sent to the group chat. Those stitches are, I don't know, different. I practice a lot. Nobody learns to suture like that from YouTube videos, James said. That's field technique. Military field technique. The room went very quiet. Kira sipped her coffee, face neutral. I practice a lot, she repeated. Her pager buzzed. Trauma incoming. Multi-vehicle accident. All available surgical staff report to ER. She set down the coffee, still half full, and walked toward the door. James called after her. Hey, Hayes. Just so you know, Brennan's asking questions about you. Might want to have better answers ready. She didn't respond. The ER was already transforming when she arrived. Gurneys being prepped, nurses running IV lines, the charge nurse barking assignments. Kira found Marcus near Trauma Bay 2, stocking supplies. He saw her, nodded. Big one. Construction site collapse. At least 5 critical coming in hot. How long? 4 minutes out. Kira pulled on a fresh pair of gloves, tied a new mask. Her hands were steady. Her heartbeat was steady. Everything was steady. Until the ambulance doors burst open and the real work began. The first gurney came through fast. Paramedics on either side pumping a bag valve mask. The patient's chest rising and falling in forced rhythm. Blood soaked through the sheets in dark spreading patches. Male, late 20s, crush injury to chest and abdomen, BP 80/50, heart rate 130, decreased breath sounds on the right side. Doctor. Brennan appeared from somewhere, moving with the controlled urgency of someone who'd done this 1,000 times. He pointed at Kira without looking. Hayes. Bay 4. Least critical. Compound fracture, possible internal bleeding. Keep him stable until we clear the major traumas. Understood. She moved toward Bay 4 where a second gurney was arriving. A man in his 40s, construction vest still on, hard hat cracked and hanging by the chin strap. His left leg twisted at an angle that made the nearby medical student look away. Kira stepped to the bedside, hands already assessing. Pulse at the neck, strong but rapid. Pupils equal and reactive. Airway clear. Breathing labored but present. "Sir, can you hear me? I'm Dr. Hayes." The man's eyes found hers, wide with pain and fear. "My leg. Jesus Christ, my leg." "I know. We're going to take care of it. What's your name?" "Thompson. Mike Thompson." "Okay, Mike. I need you to stay still for me." "Can you do that?" He nodded, teeth clenched. Kira's hands moved over his abdomen, pressing gently, systematically, checking for rigidity, for guarding, for the subtle signs that something inside was bleeding where it shouldn't. She found it low on the left side, a firmness that didn't belong, swelling, the beginning of a hematoma that would grow if she didn't act. "Get me an ultrasound. Now." The nurse, a young man named David, grabbed the portable unit, wheeled it over. Kira took the probe, applied gel, placed it against Mike's abdomen. The screen flickered to life in grayscale waves. There, free fluid in the peritoneal cavity. Not much yet, but growing. Internal bleeding from a lacerated spleen or liver, maybe both. "Mike, you're bleeding internally. We need to get you to surgery right now." The leg is secondary. If we don't stop the internal bleeding first, the leg won't matter. She turned to David. "Page the OR. Tell them we need a bay in the next 10 minutes. Type and cross for 4 units. Get Dr. Okonkwo down here." David hesitated. Dr. Brennan said, "I don't care what Dr. Brennan said. This patient needs surgery now or he'll bleed out in the next hour. Page them." David ran. Kira placed another IV line, started fluids wide open, checked vitals again. BP dropping. 75/45. Heart rate climbing. 145. Mike's face was going pale, the kind of pale that precedes shock. "Stay with me, Mike. You're doing great." "I don't feel great." "I know, but you're going to be fine. I promise." She didn't make promises lightly. Footsteps behind her. Dr. Brennan's voice cut through the noise. "Hayes, what the hell are you doing? I told you to stabilize and wait. He has a lacerated spleen with active hemorrhage. He needs surgery immediately." "Based on what?" "A portable ultrasound reading from a second-year resident?" Kira turned, met his eyes directly. "Based on free fluid in Morrison's pouch, distended abdomen, dropping blood pressure, and rising heart rate. All classic signs of intra-abdominal hemorrhage." Brennan stepped closer, looked at the monitor, at the ultrasound screen still showing the frozen image. His jaw worked. "You're sure?" "Completely." He stared at her for 3 long seconds, then nodded sharply. "Get him to OR 2. I'll scrub in. I'd like to assist." "You've done enough, Dr. Hayes." "With respect, sir, I found it. I'd like to see it through." Brennan looked like he wanted to argue, then glanced at the clock, at the other traumas still flooding in, at the chaos barely contained around them. "Fine, but you follow my lead. No improvisation." "Yes, sir." They moved Mike to the OR in under 8 minutes, a small miracle given the circumstances. Kira scrubbed in alongside Brennan, the hot water and antiseptic soap washing away the ER grime, but not the adrenaline. Through the glass, she could see the OR team prepping Mike, draping him, connecting monitors. Brennan scrubbed next to her, silent for a moment, then, "Where did you learn to read an ultrasound that fast?" "Practice. That's the 3rd time today you've said that. I'm starting to think it means something else." Kira said nothing. They entered the OR. The anesthesiologist had Mike under, breathing controlled by machine, vitals displayed on screens that beeped and hummed their electronic symphony. Brennan extended his hand. "Scalpel." The nurse placed it in his palm. He made the first incision, a long, clean line down the midline of Mike's abdomen. Layers of tissue separated under the blade. Skin, fascia, muscle. Then the peritoneum. Blood welled up immediately, dark and thick. Suction. Kira provided it, clearing the field so Brennan could see. The spleen came into view, lacerated along its lower pole, bleeding steadily into the abdominal cavity. "There's your hemorrhage, Dr. Hayes. Good catch." He worked quickly, clamping vessels, tying off bleeders, checking for additional injuries. The liver was intact, the stomach untouched. Just the spleen, damaged but salvageable if they moved fast enough. Retractor. Kira held the retractor, maintaining exposure while Brennan sutured the splenic capsule, tiny, precise stitches that would hold if Mike didn't do anything stupid in the next 6 weeks. 15 minutes in, the bleeding stopped. 23 minutes in, the cavity was clean. 31 minutes in, they were closing. Brennan stepped back, peeled off his gloves. Textbook repair. He'll recover fully. He looked at Kira. "You may have just saved his life, Dr. Hayes. Just doing my job." "No, you went beyond your job. You identified something I would have missed for another 20 minutes, maybe longer. By then, he'd have been in shock, possibly irreversible." The OR staff had gone quiet, listening. Brennan continued. "I misjudged you. I apologize." Kira met his eyes. "Thank you, sir. But I still want to know where you learned to move like that. Those aren't the skills of someone 8 weeks into a new program." Before Kira could answer, the OR doors burst open. Marcus stood there, still in his ER scrubs, face urgent. "Dr. Brennan, we need you. Now. Multi-vehicle collision patient just arrested. They've been doing CPR for 8 minutes. Dr. Okonkwo's calling it." Brennan moved immediately. "Hayes, finish closing and get him to recovery. I can help with the arrest. You've done enough for one day." "Sir." He was already gone. Kira looked down at Mike, stable, breathing, alive because she'd seen what others missed. The surgical nurse, an older woman named Linda, spoke quietly. "That was impressive, doctor. Thank you. I've been working trauma for 19 years. I've seen residents freeze. I've seen attendings miss obvious signs." She paused. "You didn't freeze. You didn't miss anything. That's not normal for someone at your level." Kira finished the last suture, checked the dressing. "I had good teachers." "Military teachers?" Kira's hand stilled for just a fraction of a second. "Why does everyone keep asking me that?" Linda smiled gently. "Because some of us know what training looks like when it's been earned in places that don't make it into textbooks." Kira stripped off her gloves, washed her hands one more time. Through the walls, faint but unmistakable, she heard the sound of a code blue alarm. Someone was dying down the hall, and something in her chest pulled tight. The old instinct she'd spent 3 years trying to bury, rising up like a held breath finally released. She walked toward the sound. If you want to see what Dr. Hayes does next, what impossible choice she makes in the next few minutes that will change everything, make sure you subscribe to Emergency Hero Stories, because what happens in Trauma Bay 3 will leave you speechless. Where are you watching from? Let us know in the comments. The code blue alarm screamed through the corridor like a living thing. Kira pushed through the double doors into Trauma Bay 3. The scene unfolded in controlled chaos. 4 people surrounding a gurney, hands moving in rhythm. Compressions on a chest that wasn't moving on its own. A ventilation bag pumping air into lungs that wouldn't take it voluntarily. Dr. Rachel Okonkwo stood at the head of the bed, calling out orders with the mechanical precision of someone following protocol even when protocol was failing. Continue compressions. Push another round of epi. Charge to 200. The defibrillator whined as it built voltage. Clear. Everyone stepped back. The patient's body arched as electricity shot through dying tissue. The monitor showed a brief flutter, then returned to the flat, terrible line that meant nothing, meant gone, meant over. Resume compressions. Kira moved closer, eyes scanning the patient. Male, late 20s, athletic build, construction vest torn and bloody, face pale as paper. A piece of rebar had gone through his lower abdomen, removed at the scene by someone who didn't know better, and now he was bleeding out internally despite the pressure bandages wrapped around his midsection. The blood soaking through those bandages was dark, almost black, venous bleeding. Massive volume loss. She looked at the monitor. 14 minutes of CPR. No meaningful cardiac activity. Marcus was doing compressions, sweat running down his temples despite the cold OR air. He glanced up, saw Kira, something flickering in his eyes. Recognition. Hope. Something. Dr. Brennan stood near the foot of the bed, arms crossed, face grave. Rachel checked her watch. 16 minutes. No response to 3 rounds of epi, 2 defibrillations, continuous high-quality CPR. She looked at Brennan. Call it? Brennan nodded slowly. Time of death. Wait. Kira's voice cut through the noise. Everyone turned. Rachel's face hardened. Dr. Hayes, this patient has been down for 16 minutes with massive internal hemorrhage. He's gone. He's not gone until we've exhausted every option. We have exhausted every option. There's nothing left to do except let him go with dignity. Kira stepped closer to the gurney, eyes moving over the patient's body with the systematic assessment of someone reading a language others couldn't see. The injury pattern. The location of the impalement. The color of the blood. The way his abdomen was distended on the left side. She'd seen this before. Not here. Not in Seattle in a clean, bright trauma bay with protocol and hierarchy and people who'd never had to make decisions with mortars falling in the background. She'd seen it in a field hospital in Kandahar, in a tent in Syria, in the back of a helicopter losing altitude over hostile territory. He has a retroperitoneal hemorrhage. The rebar severed the iliac artery. That's why nothing we're doing is working. His blood volume is pooling in his abdomen instead of circulating. Brennan frowned. Even if you're right, there's no way to access that surgically in time. He'd be dead before we got him open. There's another way. What way? Kira's mouth went dry. The words she was about to say would open doors she'd spent 3 years keeping closed. REBOA. Resuscitative endovascular balloon occlusion of the aorta. The room went completely silent. Rachel stared at her. That's a battlefield procedure. We don't use that here. We should. It's experimental, high risk. The complication rate is lower than the mortality rate of doing nothing. Kira's voice stayed calm, but there was steel underneath now. If we place a catheter through the femoral artery, thread a balloon to the aorta, and inflate it above the hemorrhage site, we can stop the bleeding long enough to get him to surgery. Brennan stepped forward. You're talking about occluding the aorta, cutting off blood flow to the entire lower body. Temporarily, just long enough to stabilize him. And if the balloon migrates, if we can't deflate it in time, if we cause an aortic dissection, then he dies. But he's dying right now anyway. Marcus stopped compressions, arms shaking from exertion. The patient's chest lay still. She's right, Marcus said quietly. I've seen this procedure. It works. Rachel's eyes snapped to him. You've seen it? Where? Kandahar, 2016, field hospital. We had a Marine with almost the same injury. They used REBOA. He lived. This isn't a war zone. No, Kira said, but the patient doesn't know that, and neither does his anatomy. Brennan looked at the monitor. Still flatline. Looked at the clock. 17 minutes down. Do you know how to perform this procedure, Dr. Hayes? The question hung in the air like a blade. Kira felt the weight of every eye in the room, felt the moment compressing around her, the past and present colliding, the choice between who she'd been and who she'd pretended to be. Yes. How? I've done it before. Where? Before Kira could answer, the trauma bay doors opened. A paramedic stepped in, older, maybe mid-40s, military haircut going gray at the temples, face weathered by sun and experience. His name tag read, J. Volkov. His eyes found Kira, and everything about him stopped. Holy shit, he said, voice barely above a whisper. Major Hayes? The room temperature seemed to drop 10 degrees. Rachel turned slowly. Major? Volkov stepped closer, eyes wide with something between disbelief and relief. Major Kira Hayes, Navy. I was Marine Corps, attached to your surgical team in Syria, 2018. You saved my lieutenant's life after an IED took out half his torso. He looked at the others. She performed a REBOA in the back of a moving helicopter under fire. If anyone in this hospital can do it, it's her. Silence. Complete, crushing silence. Brennan stared at Kira like he was seeing her for the first time. You're military? I was. Navy surgeon? Yes. And you didn't think that was worth mentioning? I left that behind. Clearly not far enough behind if you're suggesting battlefield procedures in my ER. Kira met his eyes, and for the first time all day, she let the mask slip. Let him see the person underneath the quiet second-year resident who kept her head down and followed orders. That man on the table is 28 years old. His name is Daniel Foster. He has a wife and twin daughters who are 4 years old. I know this because his wallet fell out during transport and Marcus picked it up. She gestured at the gurney. He deserves every chance we can give him, and I can give him one more. Brennan looked at Daniel's still face. At the monitor. At the clock. 18 minutes. He looked back at Kira. If you're wrong, I'm not wrong. If you're wrong, I'll have your medical license. If I'm wrong, he's already dead. So we have nothing to lose. Brennan's jaw worked. Then he stepped back. Do it. But I'm supervising every step. Kira moved to the gurney, hands already reaching for supplies. I need a femoral line kit, ultrasound, a reboa catheter if we have one, and if not, the longest arterial catheter we have with a balloon tip. I need 10 units of O negative ready to transfuse, and I need someone to restart compressions right now. Marcus was already moving, hands on Daniel's chest, pushing down in steady rhythm. Kira pulled on fresh gloves, her movements shifting into a different mode entirely. No hesitation, no second guessing. This was the person she'd been before. The person she'd tried to leave behind. The person who refused to let people die when there was still a chance. The ultrasound probe was cold in Kira's hand as she positioned it over Daniel Foster's groin, searching for the femoral artery through layers of skin and tissue that showed gray and black on the screen. There. The artery pulsed weakly with each compression Marcus delivered, a thread of blood flow trying desperately to sustain a body that was already half gone. I have visualization, prepping the site. Her hands moved automatically. Betadine swab in wide circles, sterile drape, local anesthetic, even though Daniel couldn't feel anything anymore. Muscle memory from 100 procedures performed in places where sterile technique was a luxury, and speed was survival. Rachel stood across from her, face tight with doubt, and something else. Curiosity, maybe, or the beginning of respect. You're really going to thread a catheter into his aorta? Yes. In a hospital corridor trauma bay. I've done it in worse places. Kira picked up the needle. 18 gauge, long enough to reach deep. She positioned it at a 60-degree angle. Eyes on the ultrasound screen, watching the needle tip appear as a bright white line descending toward the artery. 1 breath, 2. She advanced the needle. The arterial wall dimpled, then gave way. Dark blood flashed back into the catheter hub. I'm in. She threaded the guide wire through the needle, smooth and steady, watching on ultrasound as it snaked up into the iliac artery, then higher, toward the abdominal aorta. Brennan leaned closer, watching every movement. How many times have you done this? 12. Success rate? 10 survivors. And the other 2 were already dead before I started. Just like this one. She removed the needle, left the guide wire in place, picked up the dilator. This was the dangerous part. Enlarging the arterial puncture enough to fit the balloon catheter without tearing the vessel or losing guide wire position. She advanced the dilator over the wire, applying firm, steady pressure. The tissue resisted, then accepted the intrusion. Dilator in. Hand me the catheter. The nurse placed it in her palm. 7 French diameter, balloon tip capable of complete aortic occlusion, designed for exactly this scenario in exactly this kind of desperate moment. Kira threaded it over the guide wire, feeding it centimeter by centimeter into Daniel's arterial system, a snake of plastic and hope traveling upstream against the failing current of his circulation. On the portable X-ray screen that someone had wheeled over, she watched the catheter's radiopec tip climb higher, past the iliac bifurcation, past the renal arteries, up to the level of the diaphragm, just above where she estimated the hemorrhage was flooding his retroperitoneal space with blood that should have been in his heart. Catheter in position, removing guide wire. She pulled the wire free, checked for blood return. Good flow. The catheter was patent, positioned correctly, ready to do what it was designed to do. Inflating balloon. She attached a syringe to the balloon port, began pushing saline into the tiny inflatable cuff at the catheter's tip. On the pressure monitor, she watched the numbers change. 1 milliliter, 2, 3. At 4 milliliters, the balloon was fully inflated, pressed against the walls of Daniel's aorta, creating a complete seal. Everything below that seal was now cut off from circulation. Everything above it was about to get the blood flow it desperately needed. Balloon inflated. "Marcus, stop compressions." Marcus lifted his hands, stepping back, chest heaving from exertion. The room held its breath. The monitor showed flatline for 1 second. 2, 3. Then a single blip appeared. Weak, disorganized, but present. Electrical activity. Rachel's eyes widened. "Oh my God." Another blip, stronger this time. Then another. Then a rhythm, slow and irregular but undeniably real. A heartbeat. Dr. Brennan stared at the monitor like it was showing him something impossible. "His heart is beating. Because it finally has blood to pump," Kira said. "The balloon is stopping the hemorrhage. All the volume he has left is staying in his upper body. It's not much, but it's enough to perfuse his brain and heart. For how long? Maybe 30 minutes before ischemic damage to his lower body becomes irreversible. We need to get him to an OR immediately, repair the iliac artery, and deflate the balloon." Brennan was already moving, pulling off his gloves, reaching for his phone. "This is Brennan. I need OR1 opened now. Vascular surgery team. We have an arterial repair that can't wait." He paused, listening. "I don't care if Dr. Simmons is in the middle of something. Pull him out. This patient will be dead in 30 minutes if we don't move." He hung up, looked at Kira. "You're scrubbing in." "Sir, that's not a request, Major Hayes. You put that balloon in his aorta. You're seeing this through to the end." The title hit her like cold water. Major Hayes. She hadn't heard that in 3 years. Hadn't allowed herself to be that person, to carry that weight, to remember what it meant to make decisions where failure equaled death and success was measured in heartbeats. But here it was again, pulled out of her like something buried too shallow. Rachel stepped forward, voice quieter now. "Why did you leave? If you were this good, if you saved lives like this, why walk away?" Kira looked down at Daniel Foster, at his chest now rising and falling on its own, at the color slowly returning to his face as oxygenated blood finally reached his brain. "Because I got tired of deciding who lived and who died. But you just did exactly that." "No. I just refused to accept that he was dead. That's different." "Is it?" Before Kira could answer, Volkov spoke up from near the door. He'd been standing there silently, watching, the recognition on his face mixing with something deeper. Gratitude, maybe, or understanding. "Major Hayes saved 37 lives in Syria. That's not counting the ones in Afghanistan before I met her." His voice was rough, thick with emotion. She worked 18-hour shifts in a tent with mortar fire coming in every night. She performed surgeries that shouldn't have been possible. And then one day her medical transport got hit by an RPG. 3 people died. She blamed herself. The room was silent. Kira's hands, still holding the syringe connected to Daniel's aortic balloon, trembled slightly. "That's enough, Volkov." "No, ma'am, it's not. Because these people need to know who you are, not who you're pretending to be." Brennan's voice cut through. "Is that true? You were in a helicopter crash?" Kira didn't look at him. "Yes. And you have PTSD?" "Had. I was cleared for duty 6 months ago." "But you didn't go back to military medicine?" "No." "Why?" She finally looked up, met his eyes. "Because I wanted to save lives without wondering if the person I was operating on would go back out and get killed the next day. I wanted medicine to be about healing, not just damage control." She gestured at Daniel. "But apparently I can't escape what I was trained to do." Brennan studied her for a long moment. "Good. Because we need what you can do. We need it right now in OR1. So whatever identity crisis you're having, put it on hold. This patient needs a surgeon. And you're the only one in this building who's done this procedure before." The gurney was already moving, nurses guiding it toward the OR. Daniel's monitor beeping its fragile rhythm, the balloon in his aorta buying him time measured in minutes. Kira walked alongside, one hand on the IV pole, mind already 3 steps ahead. incision site, exposure of the iliac artery, repair of the laceration, gradual deflation of the balloon, while maintaining blood pressure, closure, recovery. She'd done this before. She could do it again. But as they pushed through the OR doors, as the lights overhead blazed white and sterile, as she stepped to the scrub sink and began washing her hands for the second time that night, she felt the weight of two worlds pressing against each other. The person she'd been, the person she'd tried to become, and somewhere between them, the person she actually was. The water ran hot over Kira's hands, antiseptic soap turning pink as it washed away Daniel Foster's blood. Through the glass window separating the scrub room from OR1, she could see the surgical team prepping him, draping his abdomen, connecting fresh IV lines, the anesthesiologist adjusting ventilator settings while watching the monitor that showed a heartbeat that shouldn't exist. Dr. Brennan scrubbed beside her, methodical and silent. Finally, he spoke. 7 years Navy, combat surgeon. Why didn't you put that on your residency application? Because it would have defined me. Everything I did would have been measured against it. Instead, you let us think you were inexperienced. I let you think what you wanted to think. He shut off the water, grabbed a sterile towel. That stops today. When we walk into that OR, you're not a second-year resident anymore. You're the surgeon who's done this procedure before. I'm backing you up, not the other way around. Understood? Kira looked at him through the glass partition, saw the operating table where a man lay balanced between death and a chance she'd given him. Understood. They entered the OR. The surgical nurse helped Kira into her gown, tied it in back, snapped gloves onto her hands. The familiar weight of sterile fabric settled over her shoulders like old armor she'd forgotten she owned. She stepped to the table. Daniel Foster lay motionless under the drapes, only his abdomen exposed, prepped orange with betadine, the balloon catheter extending from his femoral artery like a lifeline to borrowed time. Scalpel. The word came out steady, carrying the authority of someone who'd said it hundreds of times in worse conditions. The nurse placed the blade in her palm. Kira made the incision, a long vertical line from pubic bone to umbilicus, cutting through skin and subcutaneous fat in one smooth motion. Blood welled up immediately, but it was surgical bleeding, controlled, expected. Bovie. She cauterized the small vessels, the smell of burning tissue sharp and chemical. Beneath the fat layer, the fascia appeared, white and fibrous. She divided it, then carefully opened the peritoneum. Blood poured out. Dark venous blood mixed with bright arterial spray, filling the abdominal cavity, the retroperitoneal space distended with hemorrhage that had been killing him since the moment the rebar was pulled free at the construction site. Suction. Large bore. 2 suction catheters worked simultaneously, clearing the field while Kira's hands moved deeper, packing the area with laparotomy pads, tamponating bleeding while she gained exposure. Rachel stood across from her, assisting, eyes wide behind her surgical mask. There's so much blood. There always is with arterial injuries. Kira's voice was calm, almost distant, the voice of someone who'd learned to disconnect emotion from action. Retractor. I need to see the iliac bifurcation. The retractor went in, held by a surgical resident whose hand shook slightly. Kira didn't comment. Everyone's hands shook their first time seeing this much blood. She dissected carefully through the retroperitoneal tissue, following the path of the hemorrhage backward to its source. The external iliac artery came into view, normally the size of a drinking straw, now torn along its lateral wall. A 2-centimeter laceration that had been pouring Daniel's blood volume into spaces it didn't belong. There it is. Brennan leaned in, examined the injury. Clean edges. Repairable. But you'll need to deflate the balloon before you can suture, or you'll have no flow to test the repair. I know. Which means once I deflate, he'll start bleeding again. I'll have maybe 2 minutes to get a vascular clamp on proximally and distally before he exsanguinates. Can you do it? Kira met his eyes over the surgical field. I've done it before. When? Fallujah, Helmand Province, Al-Tanf. Should I keep going? Brennan said nothing. Kira turned to the anesthesiologist, a calm-faced woman named Dr. Patel. I need you to push 2 units rapidly when I tell you. His pressure is going to drop hard the moment I deflate this balloon. Be ready to transfuse everything we have. Understood. Kira positioned 2 vascular clamps within reach, checked their tension, set them precisely where her hands could find them in the seconds that would matter. Then she reached down to the catheter extending from Daniel's femoral artery, found the balloon port, attached a syringe. Deflating balloon in 3, 2, 1. She pulled back on the syringe. The saline came out slowly. 1 milliliter, 2, 3, 4. The balloon collapsed. Blood flow returned to Daniel's lower body, and immediately the lacerated iliac artery began spraying blood into the surgical field like a broken faucet. The monitor alarmed. Blood pressure dropping, 90/60. 80/50, 70/40. Transfusing now, Dr. Patel called out. Kira's left hand clamped the artery proximal to the injury. Her right hand clamped it distal. The bleeding stopped, controlled between 2 pieces of metal and her absolute certainty of where they needed to be. Suction. Clear the field. The blood disappeared, and the laceration lay exposed, edges clean, repairable. 6-O-proline. Double-armed. The suture appeared in her hand. 2 needles on either end of a single strand of synthetic thread, thinner than hair. She began to sew. Each stitch was precise, placed exactly 2 millimeters apart, catching the full thickness of the arterial wall without penetrating the interior lumen. Her hands moved like they were playing an instrument, a piano or violin, something that required muscle memory deeper than conscious thought. The room was silent except for monitors beeping, the ventilator's rhythmic hiss, and the soft sound of needle passing through tissue. 12 stitches to close the laceration, 12 chances to make a mistake that would mean Daniel Foster would never see his daughters again. She didn't make a mistake. The final stitch went in, was tied, was cut. Release the distal clamp. The resident released it. Blood filled the artery below the repair, pressure testing the suture line. No leaks. Release the proximal clamp. Blood flowed through the repair, full arterial pressure, the moment of truth. The suture line held. Perfect. Kira stepped back, peeled off her gloves, and for the first time in 20 minutes, allowed herself to breathe fully. The monitor showed blood pressure stabilizing, 100/65, 110/70, rising, heart rate slowing from panicked to controlled, 120, 110, 98, oxygen saturation climbing, 89%, 92%, 95%. Doctor. Patel's voice carried relief like oxygen. Vitals are stabilizing. He's responding. Rachel stared at the surgical field, at the repair that had taken 8 minutes and looked like it had been placed by a machine. I've never seen vascular work that precise. Kira didn't respond. She was watching Daniel's face, watching the color return, watching the signs of perfusion that meant his brain was getting oxygen, his heart was getting oxygen, his body was remembering how to stay alive. Brennan moved to close the abdomen, layer by layer, while Kira supervised, checking for additional bleeding, for missed injuries, for anything that might try to kill this man after they'd fought so hard to save him. There was nothing. Just clean tissue, controlled bleeding, and a repair that would hold for the next 50 years if Daniel Foster took care of himself. They closed the skin with staples, applied dressings, transferred him to the gurney for transport to intensive care. As the OR team wheeled him out, Marcus appeared in the doorway. He'd changed scrubs, cleaned up, but his eyes were red-rimmed from exhaustion or emotion or both. He's alive? Kira nodded. He's alive. Because of you. Because we didn't give up. Marcus stepped closer, lowered his voice. I saw what you did in Syria, Major. I was there the night you saved Lieutenant Morrison after the IED took out his convoy. Everyone said he was dead. You refused to accept it, just like tonight. That was a different person. No, ma'am. That was the same person. You just forgot for a while. He left. The OR emptied. Nurses cleaning instruments, residents documenting the procedure, the anesthesiologist reviewing drug logs. Within 5 minutes, only Kira and Brennan remained. Brennan removed his surgical cap, ran a hand through gray hair. I need to know something. Sir, why did you really leave the Navy? And don't tell me it was because you wanted civilian medicine. I've seen too many combat vets to believe that's the whole story. Kira was silent for a long moment, staring at the empty operating table where Daniel Foster had been dead and was now alive. Finally, she spoke. Kandahar, 2019. Medical evacuation helicopter carrying 3 wounded Marines and 2 civilian contractors. I was the attending surgeon. We got hit by an RPG 10 minutes from base. Her voice stayed level, clinical, like she was describing someone else's trauma. The pilot kept us in the air long enough to crash land inside the perimeter. I survived. 2 others survived. 3 died because I couldn't get to them fast enough with the cabin on fire and my legs pinned under debris. That wasn't your fault. I was the ranking medical officer. It was my responsibility. You can't save everyone. She looked at him directly. That's what they told me during the investigation, during the medical board review, during the psych evaluations. She paused. I'm tired of not being able to save everyone, Dr. Brennan. I'm tired of making life and death decisions and living with the ones that didn't work. So you hid, became a second-year resident, pretended you didn't know things you know better than most attendings. Yes, that stops now. I know. The ICU was quiet at 3 a.m, the kind of quiet that exists only in hospitals where machines breathe for people and monitors count heartbeats like prayers. Kira stood outside Daniel Foster's room, watching through the glass as his chest rose and fell with the ventilator's rhythm. His wife had arrived an hour ago, was sitting beside him now holding his hand, whispering things Kira couldn't hear but could imagine. He's going to make it. Dr. Brennan's voice came from behind her. She hadn't heard him approach. Yes, because you refused to let him die. Because we all refused. Brennan moved to stand beside her, both of them watching the scene through glass like observers of a life they'd pulled back from the edge. I owe you an apology, Dr. Hayes. A real one, not the half-hearted thing I said in the ER. You already apologized. That was before I knew who you were. Before I understood what I was actually looking at. He turned to face her. I saw a second-year resident who transferred programs twice. I assumed incompetence or instability. I never considered that maybe you were running from something that had nothing to do with skill. Kira said nothing. I made assumptions based on prejudice and hierarchy. I was wrong. And because I was wrong, I almost cost that man his life by assigning you to minor cases instead of recognizing what you were capable of. You couldn't have known. I should have looked harder, should have asked better questions. He paused. The Navy doesn't just let combat surgeons walk away. What really happened? Kira kept her eyes on Daniel Foster, on the wife who would take him home to twin daughters who would grow up with a father because of decisions made in seconds. The investigation cleared me of wrongdoing in the helicopter crash. Said I performed appropriately given the circumstances. Recommended me for continued service. Her voice was steady, but something underneath it wasn't. But they also found evidence that the mission had been compromised, that someone in command had leaked our flight path to hostile forces, that we were targeted deliberately. Brennan's face went pale. You're saying you were set up? I'm saying 3 people died because someone decided a medical evacuation was acceptable collateral damage for whatever operation they were really running. She finally looked at him. I couldn't stay after that. Couldn't trust the system. Couldn't trust that the next time I loaded patients onto a transport, someone wouldn't be selling that information to the highest bidder. Jesus Christ. So I took the medical discharge for PTSD, spent 2 years in therapy, applied to civilian residency programs under my maiden name. Started over. And tonight you had to become that person again. Tonight I had to stop pretending I wasn't still that person. They stood in silence, watching Daniel Foster's monitor trace the rhythm of a life continued. Finally, Brennan spoke. I have a proposal for you. Sir, St. Catherine's has been trying to establish a trauma protocol training program for 2 years. We have the funding, the board approval, the facility. What we don't have is someone with the expertise to design the curriculum. He turned to face her directly. I want you to do it. Not as a second-year resident. As a senior trauma surgeon with full privileges and complete autonomy over the program. Kira stared at him. You're offering me an attending position? I'm offering you the chance to teach others what you know. To take the experience you gained in places most of us will never see and translate it into protocols that save lives here. He paused. We need what you can do, Dr. Hayes. and I think maybe you need to stop hiding from it. I don't know if I'm ready. You resurrected a dead man tonight using a procedure most civilian surgeons have never heard of. I think you're ready." Before Kira could respond, footsteps approached from down the corridor. Dr. Sarah Lim, the hospital's chief of medicine, walked toward them with the purposeful stride of someone who'd been woken at 2 a.m. and wanted answers. She stopped in front of Kira. "Dr. Hayes. Or should I say, Major Hayes. Doctor is fine, ma'am. I've spent the last hour reviewing your service record, the real one, not the redacted version you submitted with your residency application." Dr. Lim's expression was unreadable. 847 combat surgeries, 92% survival rate in conditions that would make most surgeons quit medicine entirely, 3 commendations for surgical excellence under fire, and a medical discharge that, according to the Navy's internal investigation files I had to call in significant favors to access, was based on circumstances beyond your control. "Ma'am, I can explain." Dr. Lim held up a hand. "I'm not here to reprimand you. I'm here to tell you that Dr. Brennan's proposal has my full support. But I have 3 conditions." "What conditions?" "First, you stop hiding. Your military service is now part of your official record here. No more pretending to be inexperienced. No more letting people underestimate you." Kira nodded slowly. "Second, you establish a training program not just for trauma protocols, but specifically for treating veterans. We have former military patients coming through these doors every day who get better care when their doctors understand combat medicine. You can bridge that gap. And third, you talk to someone, a therapist who specializes in military trauma. Because what happened to you in Kandahar wasn't your fault, and carrying that guilt while trying to save other people's lives is eventually going to break you." Dr. Lim's voice softened. "You can't pour from an empty cup, Dr. Hayes. Take care of yourself so you can take care of others." The words hit harder than Kira expected. She'd spent 3 years avoiding therapy, avoiding the memories, avoiding anything that forced her to confront the images that still woke her at night. Fire and smoke, and voices screaming for help she couldn't provide fast enough. "I'll think about it. That's all I ask." Dr. Lim glanced at Daniel Foster's room. "His wife wants to thank you. Said she'd wait as long as necessary." Kira looked through the glass at the woman sitting beside her husband, holding his hand like it was the most precious thing in the world. "Give me a minute." She walked into the room quietly. The wife looked up, and the expression on her face nearly broke Kira's carefully maintained composure. "You're Dr. Hayes?" "Yes." The woman stood, eyes red from crying, but clear with something that looked like gratitude and wonder and disbelief all mixed together. "They told me he was dead. They said there was nothing more they could do. He wasn't dead. Just very close. But you brought him back. They said you used some kind of military procedure that no one else knew how to do." Kira looked at Daniel Foster, at the monitors tracking his recovery, at the proof that refusing to give up sometimes makes the difference. "I just did what I was trained to do." "No." The woman shook her head. "You did more than that. You gave me my husband back. Gave my daughters their father back." Her voice broke. "How do I even begin to thank you for that?" Kira felt the tightness in her chest that she'd been holding back for hours, the emotion she'd learned to compartmentalize during surgery now pressing against the walls she'd built. "You don't need to thank me. Just make sure he takes care of himself. Makes it to his daughter's graduations. Walks them down the aisle someday." "I will. I promise." The woman hugged her, sudden and fierce, and Kira stood there accepting it. This gratitude from a stranger whose life she'd changed by refusing to accept the unacceptable. When she finally left the room, Brennan and Dr. Lim were still waiting. "Well?" Brennan asked. Kira took a breath, the kind that feels like stepping off a cliff and trusting there's ground somewhere below. "I accept. All 3 conditions." Dr. Lim smiled. "Good. You start Monday. We'll announce the program at the department meeting. I expect you'll have more volunteers than you know what to do with. I'll manage." "I know you will." They walked together down the corridor, past the other ICU rooms where other patients fought their own battles, past the nurses' station where Marcus looked up and nodded in acknowledgement, past the waiting area where families held vigil. At the elevator, Brennan stopped. "One more thing, Dr. Hayes. That tattoo on your wrist. What does it actually say?" Kira pulled back her sleeve, revealed the caduceus wrapped in Morse code she'd gotten the day she left the Navy. Persist. Good word. It's kept me going when nothing else would. The elevator doors opened. Dr. Lim stepped in, held the door. You coming? Kira looked back down the corridor one last time, at the place where she'd stopped running from who she was and started accepting it. Yes, she said. I'm coming. 2 weeks later, the hospital cafeteria was more crowded than usual. Word had spread about the new trauma training program, about the surgeon who'd brought a dead man back to life, about Major Kira Hayes, and the skills she was finally willing to share. 23 residents had signed up. 15 attending physicians. 8 nurses. Even 2 paramedics from the city's emergency services. Kira stood at the front of the conference room, facing them all, feeling the weight of their expectations and their curiosity. My name is Dr. Kira Hayes. 7 years ago, I was a Navy combat surgeon. 3 years ago, I left that behind. 2 weeks ago, I stopped pretending it never happened. She paused. This program will teach you things you won't learn in textbooks. Procedures that were developed in war zones. Protocols designed for the worst-case scenarios. And most importantly, the mindset that refuses to give up when everyone else says it's over. She clicked to the first slide. A photo of Daniel Foster, awake now, breathing on his own, smiling at his twin daughters who sat on either side of his hospital bed. This is why we do what we do. 3 months after Daniel Foster walked out of St. Catherine's Medical Center on his own 2 feet, the trauma training program had become something Kira hadn't expected. A community. The simulation lab occupied the entire 3rd floor of the hospital's research wing, equipped with high-fidelity mannequins that bled realistic blood, crashed realistically, and died realistically if you made the wrong choices. Kira stood at the observation window watching a team of residents work through a scenario she'd pulled directly from her experience in Helmand Province. Multiple casualties, limited resources, impossible decisions. Dr. Rachel Okonkwo stood beside her, taking notes. They're doing better than last month. The triage is faster, more decisive. They're learning that hesitation kills more people than wrong decisions. Kira said. Is that what you learned in Afghanistan? That's what I learned everywhere. Below them, a second-year resident named Dr. James Park was performing an emergency thoracotomy on a mannequin with penetrating chest trauma. His hands moved with confidence now, nothing like the arrogant uncertainty he'd carried 3 months ago when he'd questioned Kira's credentials in the resident lounge. People changed when they learned how little they actually knew. Rachel glanced at Kira. You heard about the Pentagon's request? Dr. Lim mentioned it. And I'm thinking about it. The Department of Defense wanted Kira to design a curriculum for transitioning military medics and corpsmen into civilian trauma surgery. A bridge program that would recognize their combat experience as legitimate medical training, allow them to fast-track through residency if they proved competent. It was exactly the kind of program that would have helped her 3 years ago when she'd been trying to figure out who she was without the Navy. It's a big opportunity, Rachel said. National scope. Policy-level impact. It's also a return to something I spent 3 years running from. Or it's integrating the parts of yourself you kept separate. Rachel turned to face her. You're not running anymore, Kira. You haven't been for months. Maybe it's time to stop thinking of your military service and civilian medicine as 2 different things and start seeing them as the same mission. Before Kira could respond, her pager buzzed. Trauma incoming. GSW to chest. ETA 4 minutes. She moved immediately, Rachel following. They took the stairs down to the ER, arriving just as the ambulance backed into the bay. The doors opened, and paramedics pulled out a gurney carrying a young man, maybe 25, Marine Corps tattoo visible on his left shoulder, blood soaking through the pressure bandages on his chest. Jimmy Volkov was riding on the gurney, hands maintaining pressure, face grim. Single GSW to left chest. Entry wound below the clavicle. No exit wound. Breath sounds absent on the left. BP 90/60 and dropping. He's a vet, Major. Afghanistan. Discharged 6 months ago. They moved into Trauma Bay 3, the same bay where Daniel Foster had died and been resurrected. Kira's hands were already moving, cutting away clothing, exposing the wound, assessing damage with the efficiency of someone who'd done this in places where seconds measured the difference between survival and death. Tension pneumothorax. I need a chest tube kit now. The kit appeared. Kira's hands moved through the procedure without hesitation. Local anesthetic, incision between ribs, blunt dissection through muscle, insertion of the tube into the pleural space, air hissed out under pressure, the lung that had been collapsed now able to expand again. The patient's oxygen saturation climbed. 82%, 87%, 91%. Better, but he's still bleeding internally. Get me a chest x-ray. The portable machine rolled over. Kira positioned the plate, stepped back while the image was taken, moved immediately to the screen when it appeared. There. The bullet had nicked the left subclavian artery. Not severed, but damaged enough that blood was slowly filling his chest cavity. He needs surgery. Now. She looked at the patient's face, saw the pain and fear and something else. Recognition of what was happening. The military training that taught you to assess your own injuries and know when they were bad. She leaned close. What's your name? Corporal Ryan Mitchell, ma'am. Okay, Ryan. You've been shot, but we're going to fix it. I'm a former Navy surgeon. I've done this before. You're going to be fine. Something in his face relaxed. That trust that exists between people who've served, who understand what it means to rely on someone else's competence when your life is on the line. Thank you, ma'am. They moved him to OR2. Kira scrubbed in, ran through the procedure in her mind. Exposure of the subclavian artery, repair of the injury, chest closure, recovery. Routine for someone with her experience. But as she worked, opening Ryan's chest, exposing the damaged artery, suturing the tear with the same precision she'd used on Daniel Foster, she felt something shift inside her. This was what she was supposed to be doing. Not hiding. Not pretending. Not compartmentalizing the parts of herself that made other people uncomfortable. Using every skill she'd ever learned to save lives, regardless of where those skills came from. The surgery took 90 minutes. The repair was perfect. Ryan Mitchell would recover fully, go back to whatever life he was building after the Marines, live to be an old man telling stories about the time he got shot and a Navy doc put him back together. When Kira emerged from the OR, Dr. Lim was waiting. I heard. Another save. Just doing my job. You keep saying that like it's ordinary. Dr. Lim smiled. It's not ordinary, Kira. What you do, the lives you save, the people you teach, that's extraordinary. And the Pentagon knows it. So does FEMA. And apparently, so does the European Union Medical Coordination Office. What? They want you to consult on their emergency response protocols. Train their trauma teams on battlefield medicine adapted for civilian mass casualty events. Doctor. Lim handed her a folder. That's 3 international requests in 2 months. Your program is being studied by hospitals across the country. You've trained 47 medical professionals who are now implementing your protocols in their own departments. Kira opened the folder, scanned the letters and proposals and requests for her expertise. This is too much. This is the impact you were always supposed to have. You were just too busy hiding to see it. I wasn't hiding. I was surviving. And now you're thriving. There's a difference. Dr. Lim left. Kira stood in the corridor holding the folder, feeling the weight of opportunity and responsibility and the slow recognition that maybe she'd finally found what she'd been looking for, a way to use her past without being trapped by it. Her phone buzzed. A text message from an unknown number, but the words were familiar. Doc Hayes. This is Daniel Foster. The wife wanted me to send you this. Below the text was a photo. Daniel sitting on a beach, his twin daughters on either side of him building sandcastles, all 3 of them smiling in bright sunlight. Another message followed. We wouldn't be here without you. Thank you for not giving up. Kira stared at the photo for a long time, at the evidence of a life continued, at the ripple effect of a single decision to refuse the unacceptable. She texted back. Live well. That's all the thanks I need. 6 months later, Kira stood in a conference room at the Pentagon, presenting her curriculum design to a panel of military medical officers and civilian healthcare administrators. The program she'd developed would allow combat medics to transition into civilian emergency medicine, would recognize their training as equivalent to traditional medical education, would create pathways for people like her to contribute without losing their identity. When she finished, The room was silent. Then a colonel in the back row stood, began clapping. Others joined. Within seconds, the entire room was applauding. Afterward, as people approached with questions and business cards and requests for follow-up meetings, Marcus Chen appeared at her elbow. He'd taken a position at St. Catherine's full-time, was now the lead trauma nurse in Kira's training program, was teaching other former military medical personnel how to bridge the gap between war and peace. "You did it, Major. We did it." "No, you did it. You stopped running, stopped hiding, and started showing people what's possible when you refused to give up on yourself." Kira looked around the room at the faces of people who'd spent years trying to figure out how to translate battlefield medicine into civilian healthcare, who'd finally found someone who could build that bridge because she'd walked it herself. "I couldn't have done it alone. None of us can. That's the whole point." They walked out of the Pentagon together, into cold February air that smelled like car exhaust and possibility. Kira's phone buzzed again. Another photo from Daniel Foster. This time him coaching his daughter's soccer team, healthy and strong and alive. She smiled, put the phone away, and looked at Marcus. "What's next?" "FEMA wants you in Atlanta next month. The European Union is flying you to Brussels in March. And Dr. Lim says there's a hospital in rural Montana that desperately needs someone to establish a trauma program." He grinned. "So, basically, everything. Good." "Good?" "I spent 3 years trying to be smaller than I was, trying to fit into a space that was safe and predictable, and wouldn't remind me of everything I'd lost." Kira looked up at the winter sky, at clouds moving fast across gray expanse. "I'm done being small. I'm done hiding. If people need what I know, I'm going to give it to them, even if it means confronting the things you've been avoiding. Especially then." They walked toward the metro station. Two veterans finding their way in a world that didn't always understand what they carried, but was starting to recognize what they could offer. Behind them, inside the Pentagon, policy was being written that would change how America treated its military medical veterans. Ahead of them, in hospitals and emergency rooms and trauma bays across the country, lives would be saved by protocols Kira had designed from experience earned in places most people would never see. And somewhere in Seattle, at St. Catherine's Medical Center, a new class of residents was gathering in the simulation lab, preparing to learn from someone who'd walked through fire and come out the other side knowing exactly who she was. Dr. Kira Hayes, former Navy combat surgeon, teacher, mentor, survivor, someone who refused to give up on herself or anyone else. The monitor showed a flat line. Everyone else had stopped. She hadn't. And that made all the difference.